So I welcome you again to Uganda Cancer Institute. My name is Victoria Walusansa Abaliwano. I am a senior consultant, medical oncologist, and I head the breast cancer service at the Uganda Cancer Institute. We run a breast service that has seen over the years an increase in the breast cancer patients. We initially used to see more of very advanced breast cancer. We went out and started talking to people and communities about early diagnosis. I must say that we are not seeing enough early breast cancer. We are still staying stage 3 and stage 4, which means that the message is not yet out there. We are requesting you to take your breast health very important. Take it as an important part of your life. Whether you are a man or you're a woman, breast cancer affects definitely more women than men, but of every 10 patients that we have with breast cancer, 1 is a man. So men should also check their breasts because they are old, much as they did not grow under the influence of hormones. We see a lot of breast cancer. We see about new cases. Now I'm talking about new cases. In a year, we see about 1,000 new cases that report. But even in the community, there are those who don't come to Cancer Institute but die out, and definitely the community knows these people. So we are asking that we join the fight against breast cancer. We encourage people to go for screening. We even ourselves go for screening. Breast cancer, we also should look at how we can reduce our risk as the community to acquire or get breast cancer. Why? Because studies have shown that increased weight, obesity, and lack of exercise increase the chances of breast cancer. Studies have also showed that the use of contraceptives, especially the combined pill, has increased the risk of breast cancer. And all these lifestyle changes have happened in our country and in our communities because we see now women going to work and reading. Because when they are in class, those years that they're in class actually reduce on their reproductive life. So we are seeing more women having fewer children. Most women who are educated actually have less than 4 children. And reduced number of children increases the risk of breast cancer. That is not to say that people who have very many children don't have breast cancer. We also have people with 14 children also presenting with breast cancer. So it is something where you cannot pin that this is this, but you do everything to reduce your risk of getting breast cancer. In our community, we are seeing more young girls getting their menses, getting their first period at an early age. Maybe a study will be done by the reproductive health people, but many of the young girls, especially because of the obesity in the community, get their periods before they even are 13. We have cases of 8-year-olds, 9-year-olds, 10-year-olds beginning their periods, and it is normal. So we should watch out, especially if you're a parent to such a child. You actually should help that child to lose weight so that you reduce their risk of acquiring breast cancer in the future. There are also other behavioral habits like alcohol intake. Uganda is known as a very good alcoholic country, but that is not well. It doesn't bode well for us in the breast cancer world because it shows that we are going to have an increased rate of breast cancer. Alcohol increases the risk to breast cancer. Smoking, even people who think that they're just smoking, I think there are many other smoking activities that people are doing. People say they vape. I don't know what vaping is, but I'm told that vaping even has more nicotine than the normal smoking. Okay, these are all habits that we are learning on the net. These are habits that people are doing that show that you're classy, but actually you're classy in an unhealthy way. That also talks about the shisha, that inhaling of direct tobacco. In fact, shisha is like 100 cigarettes, 1 puff. So the young people, we have met young people here who are coming in with breast cancer, and the only link we have is that they've been taking shisha or they are in units where they work at places where shisha is given. And I know that the Tobacco Act delineated this. I think it is our role as the community to see that this is enforced, because at the end of the day, breast cancer steals our labor. It steals our youthful people, and it takes us back. It's not a developmental, it's not something that is going to add to our development. economically and even socially. We also would like to talk about people who have relatives, close relatives, first-degree relatives who have had breast cancer or any other cancer. If you have cancer in the family, you should take time to screen yourself for breast cancer more regularly than the ones who don't have, because the risk is there, especially if the person got breast cancer. If your mom, your sister, or anybody in your lineage, both sides, both on the paternal and the maternal side, if any one of them has had breast cancer, definitely your risk is high. So we should be looking at that. But there are also people who don't have any of these risks who get breast cancer, and some of those abnormalities are in the genes. And even any relative of yours who presents with breast cancer should trigger a screening for all the relatives, and regular screening, not one off and you go. Also, patients who have had a breast cancer diagnosis have an increased risk of getting another breast cancer diagnosis. That's why in certain communities, they will encourage them to also cut off the other breast, although we are still pro-conservative. And the message is that we would like all of us as a community to take breast cancer as a cancer of public health interest, because there's something we can do to encourage, first of all, to prevent, but also to ensure that the people who have it come out well by doing regular screening and early diagnosis, and ensuring that when we are brought in for treatment, we abide by the regulations of the team that's looking after you. A cancer diagnosis is not a death sentence. We should all move out to be positive and encourage those in the fight, those who are on treatment, by talking to them, by treating them well, but by also supporting them through treatment in whatever way that we can. Screening this October, this is an October breast cancer month, and we are very, very passionate about having breast cancer screened for our patients and for ourselves. Each one of you should introspect and ask yourself, have you done a mammo? When was your last mammo? For people who are at risk, many times we encourage them to do it at least every year. For people who are not at high risk, we may encourage them to do it every 3 years. And those services are available within town and at the Cancer Institute. Even at our center in Gulu, we have a mammo machine, so the people up north can actually go and screen there. Here at the UCI, the main, we have a mammo machine. And out there, the services are also there. The main hospital has. This is something that should be part of our wellness check each year as women. Yes, breast cancer is a disease that loves the old people, but in our country, we see more young people with breast cancer, and we don't know why. Maybe it may be due to our genetic predisposition. As we grow, we are seeing more women because of the increased expectancy. We are seeing more older women, even as old as 90, 80, presenting with breast cancer. But we also have the 18-year-olds, the 20-year-olds, the 30-year-olds also. So they balance themselves out, which is not the case in the Western world, where we have more older people. We don't know whether our old women died off, but we are also seeing enough young people. And the message to the young people is to embrace lifestyle change that prevents cancer, breast cancer especially, but also to engage in early screening activities, so that if it is there, it is seen early and treated, and you can go on with your life.